I'd like to acknowledge the local custodians of the land on which we meet today and honour elders past, present and emerging. I'm Melissa Wilkinson from the Hunter New England Central Coast Primary Health Network. Welcome everybody and welcome to Sandy Horton. Thank you for being with us today, Sandy. I'm just going to go through some housekeeping. We are being recorded today and a copy of this will be available in the Education Library. So if you would like to re-watch this or pick up any notes that you'd like to see, you can access it as per all our masterminds. It will be in the Education Library along with a copy of the presentation as well, and that'll be up in the next 24 hours. You will see a poll will pop up at the end of this session, and I strongly encourage you to please complete that. We really value your feedback and that helps us plan further education events. And we get some beautiful comments there too as well, which is lovely to hear. So I strongly encourage you to complete that poll at the end. You will receive a certificate too with a follow-up email. Just want to mention that sometimes it does take a couple of minutes for that to upload. So when you press on the little blue box, just let it go for a couple of minutes and it will eventually pop up. But we've noticed a couple of people are expecting it to pop up sooner than it does. But yeah, just give that a little couple of minutes there. I'll also just mention again too that a copy of the presentation and resources will be available in the Education Library. It gives me great pleasure to now hand over to Sandy. Thank you, Sandy. Looking forward to this one. Over to you, Sandy.
Thank you. Thank you very much, everyone, for joining me today. This is a presentation on knowing when and how to renew your digital health certificate. So I do want to do a little apology at the beginning of this presentation. I hope it's not death by PowerPoint presentation, but I have specifically put in copies of your step-by-step with screenshots on how to renew it. And I've done it so that you can take this presentation, open it up at your own time, and then actually follow the steps through. So please bear with me. I hope it's going to be worth it by the end. So we'll get into that. Oh, sorry, now my screen's not going to flick. So what is a NASH certificate? A NASH certificate is the National Authentication Service for Health. It's a public key infrastructure and it was introduced back in 2012 as a digital copy of your certificate instead of the old CDs that we used to get. So what does it do? It actually authenticates and securely accesses digital health services. We'll get my tongue moving shortly. Digitally signs documents and transactions and encrypt health information for secure exchange. So this little diagram just shows what your NASH does for each of your organisations. So it sits in the back end of your organisation, usually on your server, and the NASH certificate actually enables you to be able to go in and look up an IHI number. So that's where you get the number to validate for your patients. It allows you to go into your My Health record and view the information that's contained in the My Health record, and also upload your shared health summaries into the My Health record. It sits behind the electronic prescribing, and it's what sends the information up, the prescriptions up into a patient's My Health record. And when they go and get it dispensed from the pharmacy, that's what enables that dispense record to show. It's also part of your secure messaging. So when you get information sent through from your local health district, be that a discharge summary, the NASH certificate allows it to come in and sit into your clinical software system. So you can see that this NASH certificate is pretty important for a lot of different services that you have going on behind the scenes in your practice. So we don't want it to not get renewed. Otherwise, if you've got any of these particular systems that fall off or they don't work, it could be potentially because your NASH certificate has fallen off. So we need to make sure we keep this up to date. So what are the changes to the NASH certificate? Your NASH certificate is changing from a SHA-1 to a SHA-2 certificate. Now, if you're anything like me, I'd never heard of a SHA certificate in any form, so it didn't make any sense to me what the difference was between a SHA-1 and a SHA-2. So I have kept this really, really simple. What is a SHA certificate? Basically, it's an encryption certificate to allow better privacy and security. What's the difference between your SHA-1 and your SHA-2? a higher encryption certificate. So that's all it is. We know that computers are getting more powerful, hackers are getting much more cleverer, and we need to make sure that our certificates can keep them out and keep the systems working properly. So that's the only change there is for it. You can, if you want to go and get really technical on what the SHA certificate's made up of, it's all on the Australian Digital Health Agency, and you can knock yourself out with getting that information. For me, basic encryption certificate, that's all we needed. So from the 20th of September this year, SHA-2 certificates have been available through HPOS. So in the old days, we used to get a CD sent to the practice, and then we'd get a separate letter with the PIC code in it. And hopefully we were able to get both of those, and we were able to install our NASH certificates. More often than not, one of the certificate or the CD didn't come, and we had to start the whole process again. So being able to get it digitally, it's more secure, it's more accessible, and hopefully it's an easier process. So we've also now got 10,000 odd certificates that are due for renewal on the 13th of March next year. So we don't want to get to the 12th of March and find that we've got 10,000 people trying to log on to HPOS and trying to download their NASH certificate. So this is why we've actually started the process a little bit earlier. And instead of the normal renewal process was 3 months, but they've extended it out to 6 months. So from September to March, you can now renew your NASH certificate at any time. So when an organisation renews an existing NASH certificate, HPOS will assign whether it's a SHA-1 or a SHA-2, depending on your software version. Now, we only have a few software products that are available for a SHA-2 certificate, but there's more and more coming on board. But what I want to stress, and I'll keep stressing it throughout this presentation, is that you need to make sure whatever software program you are using, that you actually have the most updated version of that product available and ready to go. So if I can give you any tip early on, start doing that. If you need to upgrade, if you need to install new software, any of that sort of stuff, you need to do that from now onwards. Get that started. Okay, so in anticipation of the transition, healthcare provider organisations are encouraged to update to a new version of the clinical software system. Haven't mentioned that before, have I? And I'm going to mention it a few times. So keep on that one. First priority, what you need to do. The next thing is you need to have a look in what we call the readiness register, which will show all your software products when they are available to receive a NASH certificate. So in this presentation, I've put the link in there, and that will be continually updated as software products become available to receive the SHA-2. Now, some of you may go, oh my goodness, my software product's not available. What can I do? You can still receive a SHA-1 certificate between now and the 12th of March next year. So if your product is not ready, don't panic. We will be able to still support you with a certificate, and you will be able to do the process again later on when your software product is available. Then you can renew your NASH certificate to the SHA-2. Remembering that we want to get you to a SHA-2 certificate just to provide that better security and privacy for you guys and for your practice. All right, so prior to renewing or requesting a NASH certificate, there's a few things that we need to make sure the practice has got. So the practice must be a healthcare organisation and registered with the HI service. So if you already have a NASH certificate, you will already be registered in the HI service. If you don't have a NASH and you're not registered for My Health Records, you need to go through the process to register for My Health Records, and then you will be registered in the HI service. The user has to have a Proda account and have that linked to HPOS. So whoever is going to go and renew the NASH certificate for your practice or your organization. And I just want to point out that, it's not just general practice that needs a NASH certificate. It can also be specialist, allied health, pharmacies. All of them need this NASH certificate to be able to work with the My Health record and be able to view all of those systems. So if you are the delegated person to do that, then you need to be able to log in through your HPOS account. Now, the next one is, I hope you've all heard of these acronyms that we use, an RO and an OMO. But basically what the RO is the actual responsible officer, and that is usually the person who owns the business or the organization, or is the principal GP, pharmacist, or somebody else that is working as the most responsible person for that organisation. And they're usually the ones that would have set up your My Health record registration. From there, that RO can nominate somebody to be what we call the OMO, or the Organisation Maintenance Officer. Now, most practices have the practice manager as the OMO. What I would absolutely recommend, little tip, is that you have at least 2 people that are registered as the OMO. If that practice manager's the OMO and they're away on holidays, there isn't anybody else other than the owner of the business that can call and speak to Services Australia and actually go through if you've got any problems at all with your NASH certificate. So it's a good idea to have 2 OMOs, and you can have as many as you like, but I would recommend that you have at least 2 per practice. The next thing we need to do is we need to find out when your existing NASH certificate is due to expire. So we want to look at that, and I'll show you your step-by-steps for that. And then we want to, heaven forbid I haven't said this, we need to make sure your product software is up to date with the latest version again. So again, I think you've all got it now. All right, so this is just a simple summary of how you become the OMO if you're not already the OMO. So you can do this if you're the responsible officer. You can go into your HPOS account, and hopefully most of you will be semi-familiar with the tiles in HPOS that says your programs, and then you go into the specific ones. And I do have, Death by PowerPoint, the slides that will take us through each of those screenshots. So you will be able to see it, but this is just a summary of what it looks like if you need to check your OMO. So you'll go through all of your My Programs, your healthcare identifiers and My Health record, healthcare identifiers and manage existing records. You'll then select your organisation details, and then there is a tab that says OMO. And if you remember the tab, just keep that in the back of your mind. I'm going to show you what that tab looks like. And when you click on that, you either have the option, if you're the RO, to add a new OMO, or if you are the OMO, you will see yourself with your name attached to the organisation that you're the OMO for. Or if you're a new practice manager and you're not an OMO, you can ask to get delegation rights. So there's a button that you click to ask for delegations, and that will go to the RO for them to approve. So just a summary sheet for you to be able to make sure, because remembering that only the OMO or the RO can actually complete the renewal process for your NASH certificates. All right, the next thing we said was that you needed to check your expiry dates. So you have 2 options here. If you are the OMO or the RO, you can check it through your HPOS account. So again, I've got in option 1, just those steps of what you're going to click on to get through to it. And then you'll go through to the certificate tab, and I will show you the screenshot of exactly what that looks like. If you're not the OMO or you want to do a quick check, you can use option 2. So you can use your 4 windows. It's usually down in the left-hand side of your screen, bottom screen. Click on the search bar. If you type in certmgr.nh MSC, it will bring up personal file. In that personal file will be a certificate file. And in the certificate file, you'll find a file called General, and it starts with 800362. Now, that is the number that is the generic start for a NASH certificate for everybody. The remaining numbers at the end will be individual to your organisation. So once you find that, scroll along to the end of the line and you will see the expiry date. So you've got two ways to check. I recommend doing that sooner rather than later so you know when you need to start that renewal process. Okay, so now we get into death by PowerPoint slides. How do we request or renew a NASH certificate? So bear with me. We go into Proda. Most of you will know this. You will have seen it. Go to Service. Go to My Programs, and these little shots that you can see up here are tiles. So you click your My Programs tile. Into healthcare identifiers and my health record. Now, another tip, if you don't have that tile in your HPOS account, it is because you are not the OMO or you have not been linked to your organisation. So you will need to get that set up. And at the back, I've got some reference points where you can go in to get some information on how to do that. The next one is healthcare identifiers, manage existing records. Now, this is the same steps that you will go into to check your OMO, to check your certificates, to renew your process. So these are the steps that you go through for each of those and pretty much anything to do with My Health Records. So once you go from there, you come to My Organisation Details. Click on that. It will open up a screen here and it will tell you which organisations. You can be attached to multiple organisations, but obviously you would click on the one that's relevant to the renewal of the NASH certificate that you want to complete. Okay, so this is the screen that I was telling you about with your OMO and your certificate. So before we go to the certificate tab, I just want to draw your attention to this tab here, which is the OMO tab. Now that's where you can go in and check if you are the OMO, or you can request delegations, or you can actually get your RO to do it and they can add you. But this is the tab you go to. So going back for our renewals, we go into the certificate tab here. So we click on this. Now I've got two examples here on the screen for you. The first one you can see we're in certificates, and you can see here for under the certificate tab, and it might be a bit small, but you'll be able to see it when you get the screenshots. There are no certificates for this organisation. The reason this will show is if your last certificate was installed using the old CDs. In that way, you won't have a digital copy. It will have been a hard CD that you've installed. So what you need to do is request a NASH PKI certificate. So you will click on this button here, and then it will take you to the next steps, to the completion form, and you'll complete it as per normal. So click on that one if you don't have a certificate in here. If you do have a certificate, which will be most of you will have this in here now, you'll see the certificate type called the NASH, and you'll see that number there again, starting with the 800362. You know that is your NASH certificate. If you are doing this to check your renewal date or your expiry date, you'll see here that we've got certificate expiry date, and it tells us when you need to do the renewal of your certificate. So that's how you check it. Once you can come back in again when you're ready to renew, same way, and then you'll see you've got an action button here that says renew. So that's what we're going to click on. We want to renew our NASH certificate. All right, so this brings us up to the request form. Now, the fact that I've harped on, driven you all crazy with your software product and what version you're on, The reason I've done that is you now need to come to this box here, and it has a drop-down menu that will ask you for your specific software product and what version you are using. So you must find that out, and if at all available, get to the latest one so that it will be available for a SHA-2 certificate. Now, there may be cases where you can't get your SHA-2 certificate. So what I'm going to do is just flick across to this. This is a bit of a cheat sheet, a one-pager for you guys, which is quite easy to print out. It just shows you going into Proda, into HPOS, and your steps again to get to your certificate tab. We've clicked on Renew. So if you're lucky enough and your software product is available for a SHA-2, you can just click on select your software product from the list and get a SHA-2 certificate, and you're good to go. If that's not the case, there's a couple of other options that will now show up that are available to you. So the first one is my product is not available in the list. So that means that your product, the example of this would be that your NASH certificate is due to expire, say, at the end of November. You know that your software product is not going to be ready to receive a SHA-2 by then, but you have to renew. You still need to get a NASH certificate. So you would just click that your product is not available and you need to continue to use a SHA-1 certificate. Easy, you can still do it, and then when your product's available, you may want to renew to a new SHA-2 down the track. The other options are that you may have multiple products. So you may use a product for your appointment book and a separate product for your billing. If that's the case and both software products aren't available for a SHA-2, you need to go with the one that's the most common denominator, which is the old SHA-1 certificate. So you will need to select again the SHA-1 certificate, and you're able to do that. The last scenario that you can pick is that you can override what the system's recommending for you, and you can either select a SHA-1 or a SHA-2 certificate. The example I sort of use for this one is you may know that your software product is due to come on board for a SHA-2 certificate in a week or two, but you want to start the renewal process now. So you can select the SHA-2, but you wouldn't install it until your software product is available to accept a SHA-2 certificate. So there's a couple of different options there. After you've figured out which one of those is the most relevant for you, you'll then have that information in here. The next thing it will ask you for is a mobile phone number. Now, most of the time, it's usually the practice manager's personal mobile number, which is fine. But what I would do, tip number 2 from Sandy, is actually get a Word document, put the Word document, call it NASH certificate, PIC code, and transfer the PIC password into a Word document and make up a folder, whether it's on your server or on your C drive, called NASH certificate. And there you will put the Word document with that PIC code, and you'll put the download of your NASH certificate in there, and then you can hand that on to your IT guys to do it. It is really difficult trying to find a PIC code that's come through 6 months ago, that's not one of your contacts. You can't quickly look up your contact to remember or to find that password. So please take it off your phone, put it somewhere safe. There is cases where your NASH certificate will drop off if you have a power shortage, or you get a new server, or you get new desktops, you may need to reinstall your NASH. So it's super important that you have both the PIC code and the actual download available and ready to be found to reinstall if you need it. So from here, you agree with your terms and conditions, and then you press Save Changes. Okay, from here, it just gives you a summary. So it tells you the status of it, it's ready to be submitted, tells you the software product, heaven forbid, that you're using and what particular NASH certificate you've requested. And the other thing to check is that it's the right mobile number, because if it's the wrong mobile number, you've got to do the whole process again. So double check that. Then you're going to hit the submit button. From here, it should be 5 minutes, maybe an hour, maybe 24 hours before you get your SMS. It is usually really, really quick, but so you don't all kill me when it doesn't come through in 5 minutes time, I'm giving myself a little bit of options here. But if you haven't got it within 24 hours, then I would relook at it again and see what's going on. So what will happen first is that particular mobile number that you've put in, you will receive a text message to say that your NASH certificate for your HPIO, which is your organisation, is ready to download through HPOS and is available for 30 days. That's the other point that I really want to point out. You've only got 30 days to take it out of HPOS. Once you take it out and download it, that certificate stays valid. So it's fine, but remember, 30 days is your time limit to get it out of HPOS. And it also gives you your PIC code. So you're going to put your PIC code on a Word doc, you're going to put this download into a folder, maybe call it NASH certificates, and put it somewhere safe, ready for your IT. That's it. You've done it. Excellent. So I have put in here some helpful contact information for you, some NASH certificate contacts. If you'd usually give these guys a call, eBusiness, if you've had a change of ownership since the last NASH certificate, and you need to work out who's the owner and what name it's registered in, all that sort of stuff. And there's some other helpful ones. This link down here is to the Australian Digital Health Agency, and it's got all things to do with NASH. So if there's something that I haven't gone through or something that you want to look at, then click on this link here and it will take you to the website that will give you all the information on what's going on with NASH certificates. So again, my name is Sandy and I'm the Digital Health Project Lead for Digital Health. Our PHN has some wonderful community of practice topics. So on the screen, you can see a few of them. We've got accreditation, cancer screening, diabetes. If you're interested in becoming a member in the community of practice, you just need to click on our website and you will find the person that you contact to be connected to one of these groups. For digital health, it's obviously just my email, which is up here. And if you just email me and let me know that you'd like to be a member of the digital health community of practice, then I can send you the link of the information on how to get on board with that. So thank you everybody for going through that with me. I hope I've answered it, not gone too quickly or bored you to sleep. But if there's any questions, Mel, I'm more than happy to answer.
Thanks, Sandy. That was really informative and really appreciate it. Any questions? We've got a couple of minutes left, so pop those into the questions box. So far, it looks like you've covered everything, Sandy.
It's a good and bad thing, I think.
Oh, that's awesome. Yeah, we're just getting some really positive thank you comments, and it's been much appreciated for the education, so it's been very informative. Got another one who's just come through, and we've just had a comment from Amy saying that you're a wealth of knowledge, and a big thank you there as well from Heidi. So thank you, Heidi and Amy. All right, I'd like to thank everyone for being with us today. Really appreciate your time. I know how busy it is out there, and looking forward to seeing you. Our next mastermind will be in February, and you'll see the invite coming out over the next week or so. So thanks everybody for joining us today, and we'll speak to you soon. See you, Sandy. Bye.
Thank you. Thank you, everyone.